All attendees are in listen-only mode.
Good morning, and thank you for joining us today for Communicable Illness, Flu Season, and the Impacts of Natural Disaster. I just want to say, Kim, we know you're on the line. We did see you. For some reason, we weren't able to unmute you and make you a presenter, but I will talk about the wonderful organization here shortly. So I do apologize. There's a little technical glitch there. And there's also a slight delay on my laptop. So I may be talking to a slide that actually doesn't appear for you for a second or two. I just want to apologize for that right off the top. I'd also like to invite you to be our friend. We have been friends with y'all for about 4 years or more, so we'd like to continue that relationship. And you can connect with us at Firestorm Soul on Twitter, on Facebook at Firestorm Solutions. And the hashtag for this and any crisis coach session is hashtag crisis coach. And you can use that in your social media post to either share the session with other people once it's recorded, or if you have a question during or after or anytime, we'll respond to that very quickly. And visit us at firestorm.com and watch past webinars linked to our YouTube channel, where all Virginia Association of Independent School sessions are posted, and you can certainly register for future sessions. Our 2018 calendar will be posted soon, and we look forward to seeing you all next year.
Karen?
I'd like to give you all a special...
Karen, your slides don't seem to be advancing.
They're not?
No. Yeah, we're still seeing...
Do you see social?
No. We're seeing the kind of the starting screen of PowerPoint before you would have started the slideshow.
Okay. I'll tell you what, if you could just give me a second, I'll go on and I'll try to troubleshoot that.
Okay.
I see we do have quite a few people on the... Yeah, so hold on just a moment. What I was going to say is we are, Bill, if you wouldn't mind, I'm going to go ahead and leave the session. No, I better not do that because...
Go ahead and do that.
I do apologize.
Now it's working. We now have this, the Firestorm Social,
Okay.
Firestorm Soul, Firestorm Solutions slide. Again, I'm seeing your
There's a delay,
and
there's a bit of a delay, and I apologize for that.
Right, and Kim has joined as a panelist.
Hey, hi, Kim. Okay, so what I did want to say is thank you, Bill, for being our moderator. What I did want to tell you all was that we have a special event coming up on December 7th to close out the year. In December, we will have some special sessions with Jim Satterfield, just wrapping up the year in Crisis Coach. But on December 7th, we will be conducting our last virtual event of 2017, and that virtual event is called Lone Wolf or Terrorism, doesn't really matter, and that is going to be a virtual tabletop exercise, so you can gather your teams around a table. If you're in break during that period of time or not, it is from 2 to 4 Eastern, and we'd love for you to join. Take pictures, post them to social media, but this is going to be a really terrific session. We have Hart Brown, who is our COO with exceptional background in insurance and can talk to you a little bit about the insurance aspect of what your current policies cover, and is, again, Firestorm COO. We're going to have Jason Russell, who is a former Secret Service agent and working with Firestorm very closely to implement our behavioral risk threat assessment program. We're also going to have Dr. George Vergolius from R3 Continuum, and Dr. George is going to speak to the psychological impacts of terrorism or shootings, etc. So it's going to be a very interesting session. We look forward to seeing you, and thank you so much for your patience again. I have changed the slide. If you don't see it, I hope you do in a moment. Firestorm transforms crisis into value. We empower you to manage crisis and risk, and our expertise is in crisis management, critical decision support, crisis communications, crisis public relations, and consequence management. We are the crisis coach for crisis and risk, and we follow a predict, plan, perform methodology. This presentation is not complete without accompanying oral comments and discussion, and any work product provided by Firestorm should be read in conjunction with guidance given to you by national, regional, and local authorities, as well as your own school or district's council. Moreover, the information given in comments may not be interpreted as legal advice or legal opinion. I would like to thank the Virginia Association of Independent Schools and introduce you to Kim Fallon. Kim, would you like to say a few words and talk a little bit about any upcoming events that you have to close?
Sure. Thank you so much, Karen. I'm sorry that it was tough for me to get on. And ironically enough, with the topic of flu, I'm just getting over some kind of something. It wasn't the flu, but I'm a little deeper than usual. We just had our large Leading Learning Conference this last Monday, and that's our really big event. So the next events don't happen until 2018. So be on the lookout for our digital piece that comes out and lists all our upcoming events, and we've got a full schedule for that. But we always are grateful to Firestorm for the great work you all do with VAIS and our members on really keeping them abreast of the whole crisis management area. So thank you, Karen, Ken, and everyone at Firestorm.
Well, thank you. That was very nice of you. Kim, when you're seeing your screen, are you seeing your pretty picture on my screen?
Oh, heavens. I don't know if it's my pretty picture, but yes, I see my picture. Thank you, Karen.
And also, you do see the Virginia Association of Independent Schools website. Visit the website if you have any questions, and certainly if there's anything that we don't answer for you in this session, you can use your GoToWebinar chat or dashboard widget. That didn't come out of my mouth correctly, but y'all know what I mean. The widget on the right-hand side has a chat feature, and you can type in a question. If we don't get to it in today's session, we will forward it on to either Kim to answer for the Virginia Association of Independent Schools, or to Ken Mercer, who is next on my list of people to introduce to you. I'm Karen Masulo. I'm your Chief Intelligence Officer for Firestorm, and I had a very special reason to ask Ken to join us for this session today. So I'm going to let Ken introduce himself to you if you're not already familiar with him. He is your contact for the Virginia Association of Independent Schools for Firestorm. And Ken, would you like to talk a little bit about yourself? I know how shy you are, so would you like to lead off?
Well, good morning, Karen, and thank you, Ken, for the sponsorship of this presentation. We look forward to continuing to work with the Virginia Association Schools. I am speaking on this webinar because I have a healthcare background. I'm a graduate of West Virginia University with a degree in pharmacy. I'm a licensed pharmacist in 3 states, but I practice in Maryland. I live in Baltimore. I have 3 kids and 2 grandkids. In fact, he is my Firestorm business partner. Some of you may have interacted with Brian Mercer over the phone or sometimes in person over the last few years. I was to the Academic Advisory Committee of the Emergency Management Program at the Frederick Community College. They offer a 2-year associate's degree in emergency management. They have both the traditional on-campus program and an online program. So if anyone in your schools are interested in a course of study around emergency management, I encourage you to check out the Frederick Community College. I can get you their contact information, and my email address is on the screen as you see it. Thank you very much. I look forward to this.
Congratulations, Ken. That's terrific, and we love to see more formal training in our area, and I think that's just terrific. We're really happy for you. I also want everyone on the call to know that because of our wonderful relationship with the Virginia Association of Independent Schools, if you would like your own plans reviewed, or if you don't have any plans and you'd like to have a plan, but you don't know where to start, the Virginia Association of Independent Schools is underwriting your access to an assessment tool that, again, you can contact Ken, and he'll be happy to walk you through it. It takes about an hour, very casual conversation. I'm going to cough again. My apologies. It's that time of year. It is that time of year, isn't it? So if you would like to have that high-level sort of self-guided assessment done, it's terrific. It's a great conversation. It'll help you get a really good feel for where you want to get started in 2018 if you haven't yet. So we'd love to see some support there for you. And the reason is because of this graph I hope you're seeing on your screen. If you're not, I'll talk to it. The graph asks, have you personally read your organization's communicable illness plan? We asked this last year, and we saw the numbers increase over the previous year from somewhere about 48% to 62% saying yes, or yes, and we review it once a year. We group those two answers together. We feel so good about that, but that means there's still about 40% out there who either don't have any communicable illness plan at all or don't know what a communicable illness plan is. And we know that when there are going to be challenges in the workforce and in the education arena, it's going to bubble up from our schools because that's where the kids are. So we want to keep our eye on the national scene, the international scene, to see what's going on across the world and the country, and then we certainly want to look in our own backyards. There are a variety of challenges that we face, everything from mumps outbreaks to illness that is related to natural disaster. When we were talking about planning this session, we wanted to give you as broad an overview as possible about what your communicable illness plan can cover. And so it's not just about flu season. It's about the impacts that natural disaster or illness can have from one end of the country to another. And it's important that we look at that. Displaced individuals currently are moving from one region to another, coming into your area, and that brings new risks. So Ken is going to talk to us just a little bit about what we see on this page, risk factors and the onset of communicable diseases following natural disaster. And do you want to tell us a little bit about what we're seeing here?
There, now we're seeing it. I hope everyone else is seeing it. The graph on the left at the bottom axis shows the types of illnesses associated with natural disasters. These are waterborne diseases, airborne diseases, or vector-borne, varmint-borne diseases. On the left axis, we have the conditions that are generally present around a natural disaster. We have population displaced, we have overcrowding, we have stagnant water after flooding and heavy rains, we have insufficient contaminated water supply. So all of these things put together lead to the development of communicable illness around a natural disaster. So while we traditionally use this time of year to talk about the flu vaccine and influenza, all of this talk is around maintaining your workforce. A communicable illness plan is about maintaining your workforce. If you need people in your facilities in order to work, then you'll have to think through how you'll get the job done if those people aren't there. So that is it, Karen.
And for schools, we have an especially challenging dilemma, because not only do we have our teachers and other staff who may suddenly not be able to be in school, but then of course we have our students. So when I see a story that a school with 1,000 students had 680 of them not show up for a period of time, we know we need to take a much closer look at that. It's a real challenge. And that's what we talked about in the last couple of sessions. We talked about what we would do to keep our facilities running if we had to figure out alternate methods of delivering education, and how we can care for our employees if they were having trouble getting to the school to deliver services, vendors, suppliers, etc. So this all sort of walks together now when we're down on the ground level of an illness that could possibly be bubbling up. And when it comes to natural disasters, the biggest one is flooding. And we have all seen, I don't care what area of the country you live in, other than the desert, and even the desert has its own challenges. But we have seen some really significant flooding. I live in South Carolina, and we've had significant flooding events. We had a 1,000-year flood that wandered on up and impacted North Carolina, Virginia, et cetera. So I think we all have been affected by this. And after floods, there's always going to be an increase of disease outbreaks, everything from hepatitis C to all kinds of gastrointestinal disease. We'll talk a little bit about the reasons why. But I think also what we see is psychological distress in people who have survived. And we see that there's a certain amount of post-traumatic stress disorder 2 years afterward and on. So while it might go out of our minds, it may not be out of the minds of people who have moved into your region because they've been displaced from their own. I had a client who was having some trouble in the new organization they were working in Boston, because they had been displaced from their home of many, many years with their family after Sandy. Their home was destroyed. And so his company was terrific, and they relocated him to the Boston area. And you'd think they're somewhat similar markets, but he was really homesick. He missed his family, he missed his friends, he missed the way his job was before. And it was like a death for him. So we really have to pay attention to our teachers and our students that may have gone through a significant event and how we can assist them. And then certainly take care of our own facilities. Everything from mold to critters happens after a significant disaster. And if you have never experienced one, knock on wood right now, I'm really happy for you. But let's talk a little bit about the things that can happen. And Ken's going to speak to this in just a moment. I just want to briefly walk through a couple of these. First, in your region, when I first moved to South Carolina, let me back up a little bit. I lived in Ohio for many, many years, more than 25, and I'm from New York. So when I moved to South Carolina, I had a lot of learning to do. I had to learn what the local critters were so that I knew whether I needed to run or everything was okay when I saw a spider. So I learned what a wolf spider was, and sadly my husband is allergic to fire ants, so we figured that out pretty quickly. So we have to know what are the snakes in our area, because after a flooding event or a natural disaster, critters get displaced, and they're looking for a place as well. So we have to understand what those risks are. Please don't allow children to play in standing water. If it's a spider, what kind of a spider? Are you sure it's a spider bite and not type of infection or wound or bite? Certainly rats and other rodents in a flooding or water event are exceptionally high risk. And then when the waters recede, we have droppings and other challenges. I live in a gator neighborhood. We have water very close to us, and we've after Hurricane Matthew, we had a gator sauntering across the road. Of course, everybody ran to take pictures of it, and I have to say I did not, because I'm a coward, and I also know how fast they move. And then the last thing we come to are mosquitoes. And when I mention Hurricane Matthew, I really want to mention the mosquitoes because we got a different breed when Hurricane Matthew came through, and lately when Irma, we didn't get direct hit by Irma certainly, but we got some of that offshore, and we had different mosquitoes. And mosquitoes are scary for a very good reason. Ken, you want to talk a little bit about what your thoughts are on the tiniest predator we have?
Sure. The tiniest, deadliest animal on the page is the mosquito. Mosquitoes have been called the deadliest animal in the world because of the diseases they carry. Mosquitoes kill 1 million people in the world annually. About half of those deaths are due to malaria, and while malaria is not prevalent in the United States, floods do bring mosquitoes, and in the images you see now, the standing water are a breeding ground of mosquitoes, and you have a host of problems associated with them. A can of insect repellent in your go bag might be a nice thing to add to that. When I see the photo on the right, I think of it's stacked up. I surmise that it's wet trash. A good place for rats, mosquitoes, and all kinds of bad things. It's a good place for curious kids to want to play in that wet trash. Mold is also prevalent in that wet trash. Molds are particularly troubling for respiratory problems. Elderly and the very young suffer respiratory problems. Asthma is often triggered by molds as an allergic response. So around a natural disaster, you have those two images, standing water and wet trash, and they bring problems with it. Thank you, Karen.
And Ken, as you were just getting to, and I don't know if my screen has moved, but I wanted to move while you were talking to wildfires and illness and airborne illness. So as Ken was talking, you know, kids love to play and stuff, and so we don't know what kind of allergens and other reactions they can have and really cause challenging respiratory issues. We know when there's been flooding, if the drywall isn't replaced, especially in humid climates, here in South Carolina, nothing ever actually dries out, and it creates some significant mold issues as well as structural issues. And then we have had some just terrible wildfires from Florida to Oregon. We've seen smoky conditions that have can really exacerbate existing conditions. As Ken mentioned, young children, the elderly, those with lung or heart ailments are going to be especially vulnerable. Individuals with lung or heart disease need to make sure they have their medication, at least a 5-day supply on hand, and make sure if we know there's something coming in your schools, you may have this as a part of your plan today, and if not, think about it. If you have children who have very specific special needs or teachers because of breathing or asthma or other conditions, please make sure that everybody has consulted their physician. We have backup oxygen should it be needed. It's stored in a safe place. And all of those types of things are at the ready. And when smoke levels are high, don't burn anything in your labs. That day in lab, we're not going to go ahead and turn on our burners or use gas stoves in the kitchens if at all possible, because we don't need to add any type of pollutants to the air when the air is already full. And don't vacuum because it stirs up particles. And you know, if you smoke or if we can encourage those who do to stop, the Great American Smokeout is just a couple of days away. We'll support anyone and anytime in any way to not smoke. So we'd love to help you in that regard. So just to wrap up in this area, health risks increase after a natural disaster, specifically because of wounds, poisoning, gastrointestinal infections, and skin infections. So we get a little scratch because we have no power, we can't see, we bump into something. We then are in standing or contaminated, and that little scratch can become a significant infection. And we need to make sure that we have great first aid supplies on hand and that we have proper coverings and clothing when we're dealing with a situation such as flooding. My husband, when we decided to move to South Carolina, he bought me a moving present, and it was a wonderful pair of mucklucks. And those boots are one of the best things I've got, whether it's waders or boots or whatever. You got to protect yourself so that you can protect the children in your care in your schools. So we teach them so many wonderful things. Let's teach them about insect-borne illnesses, open wounds, how to keep themselves safe when power is out, how to purify water to avoid any kind of gastrointestinal disease, and to keep themselves and others around them safe. Now, I'm hoping in just a moment.
Karen,
Yes.
do you mind if I interject here for one point, quick point?
I don't mind if you talk the entire time.
The slide showed a bunch of healthcare risks around a natural disaster, and you might be thinking that, you know, what can you possibly do about that? But there are ways to prepare. You can be better prepared or not so prepared. Keep in mind that the healthcare system, the whole healthcare system around these events is broken also. There are broken facilities, places that aren't open because they're flooded. They have broken supply chains. They can't get the same things they normally have. And they have broken people. The people who work there are also involved in the same calamity that you're involved in. So if you are going to count on that system, I'm just going to call 911 and they're going to come get me. That may not be the case. So preparing for yourself, you are your own first responder, is the best advice. So, Karen, that's it.
You know, Ken, also, and let's encourage everyone to go to the Firestorm website. There is no fee to download the electronic version of our book, Disaster Ready People for a Disaster Ready America. It talks about this and other preparatory methods you can use following that Predict.Plan.Perform methodology. It's a free download. Go to the firestorm.com website under resources, or you can email Ken and we'll be happy to send you an electronic PDF of that. But it's wonderful and handy to have. Thank you, Ken. And speaking of what Ken was talking about, I just wanted to touch a little bit on what that breakdown of the healthcare system can look like. And we have to remember we're our own first responders. You're looking, I hope, at a picture on your screen of some people who appear to be on Army cut stretchers on what actually is a luggage trolley that is used at the airport to bring the luggage out to the airplane, because that was the only way they had to evacuate these folks. Now, this happened in 2005 for Hurricane Rita. So we're saying to ourselves, we've learned a lot since then, right? Firestorm's been talking for 10 years, so everybody ought to have plans in place. But you and I both know that during Hurricane Harvey, we saw some significantly disturbing images come out of healthcare facilities that showed people in significant distress. One of which, if you can see my screen, I hope you can, was the image of some folks in an elder care facility that were sitting and waiting for rescue in water up to their waists. And it's just such a disturbing image, especially for any of us who are caregivers for someone in your family or otherwise. And if those are children, my heart goes out to these people and any other people in this area, even the little cat in the background. Now, there's another image on the screen that says the 2017 Emergency Preparedness Rule goes into effect in 8 days. That's when I created this PowerPoint. Actually, it's less than 24 hours. And what that is for is that any healthcare facility that receives funds from the Centers for Medicaid and Medicare Services, if they are not compliant, will lose funding completely in 2018. We think we see this as a trend for other types of facilities as well. So we want to be able to follow the guidelines, not just on communicable illness, but on preparedness in general, so that we can make sure if ever this does become law that affects other institutions, schools, or other facilities, we're able to meet the need. So we can talk about that at a later date. So now let's talk about communicable illness in general. Ken, you want to talk to this slide just a little bit about how we examine what our current practices and policies are?
Sure, Karen. The screen has not flipped yet, but
oh, I'm sorry.
There we go. Organizations must thoroughly examine their all of their policies and procedures to manage a communicable illness absence. You need to think about things like screening people for entrance and for leaving, monitoring. How do you know when the outbreak is at your doorstep? Leave absenteeism policies. A communicable illness, the flu, historically, has, in a pandemic, results in about a 40% workforce displacement. So if you can run your business with 40% of your staff not there, you're going to be in good shape. If that's going to be a problem, thinking about that in advance will help you improve the odds of recovery.
And Ken, haven't we seen a mumps, a bit of a mumps outbreak in a few different places across the country? So I think everybody on this call should be aware that there is something going on.
Yeah, there's a mumps outbreak in New York, at least. Virginia is not big with the mumps yet, but these things travel. They grow legs and they move.
And the challenges that we see are when people are ill, if their children are ill, or the children are okay, but seem to be coming down with something, seem to start to be symptomatic, but mom and dad or the caretaker of the children or guardians of the children have to get to work that day, quite often we know that one of the things they may say is, you know, you look okay, why don't you go ahead to school, and if you feel bad, just go see the school nurse. Ken, can I ask you a question? Can you hear me all right now?
I can hear you fine, Karen, yes.
Oh, good. Thank you. I had to change audio, so I appreciate that. So let's just talk about some real common sense things for communicable illness that I think everybody on this call probably knows, but things we want to make sure that we do before we look at the plan altogether. So, you know, let's encourage people to stay home when they're sick and avoid close contact with people who are sick. Cover our noses and our mouths with a tissue. Use your arm. And I'm sorry if you hear my dog barking in the background. Someone is delivering something. She's interested in communicable illness too. Wash your hands, wash your hands, wash your hands, wash your hands. And in our school systems, make sure in your school library or wherever you have shared equipment that we are teaching our kids and our educators good due diligence. Make sure we have sanitation wipes available wherever. Screen wipes. Has someone ever tried to hand you their phone because they wanted you to talk to whoever they were talking to and it wasn't on speaker and you looked at their phone and thought, yeah, I don't think so. So we want to make sure that we're helping people now that we have so many devices that are mobile, that we're spreading disease in a whole new way. I was recently at the ear doctor, and she said that they're seeing so many different types of ear infections because of earbuds and the different types of earbuds and hearing loss. So we want to think about all of those things and just clean and disinfect frequently. And Ken corrected me on this slide when I created it. I have washing your hands as one of the easiest and best ways to prevent the spread of diseases. And Ken corrected me and said, washing your hands is the easiest and best way to prevent the spread of diseases. I also hope you're seeing that slide on my screen right now. This has been a most interesting. That's good. It's about to change. So we have also, remember, displaced populations. I don't know if y'all in Virginia might have seen any transient populations come through or relocate to your region from Texas or those other states that were affected by Harvey, by Irma, by Maria. And we need to be aware. Also, during that period of time, many people bugged out of Florida or left their state and went temporarily somewhere else. And so you had that influx of folks coming through. So plan for that in your plan. Make sure you think about displaced populations and how to protect yourself, your students, your teachers, your community, your vendors, your suppliers from infectious disease. The other thing that I think is very important to understand and work with, whether it be FEMA or anyone else, the Red Cross that is providing shelter services. If your school has been selected as a shelter and you're working as a shelter, you still have a double job of keeping people safe, keeping sanitation, keeping people fed. And so we really want to think about how that works in order to assure that everyone is safe. And we want to make sure that you understand, can your organization, can your school continue your core operations of education if you do it remotely? What are the special requirements? Have you tested those solutions? And have you tested them and thought about what you need if you got 3 days where you have to teach remotely, or some of your front office staff has to go one place, and maybe you have GoToWebinar and you're doing GoToWebinar training for your students. But how about by day 14? Can you still do that? Is that still a possibility? Do you have equipment? Did your equipment get ruined for any reason if there was a natural disaster, and then you have absences with illness? So we need to think through all of these things. And the way we do that is through our communicable illness planning. You can work with someone like Ken or someone who is Ken and talk through different concerns that we know you're going to face in the event of a communicable illness outbreak. We use a model of human resource policies and procedures and walk you through what is necessary for epidemic and pandemic preparedness. We first do a benchmark gap analysis of your existing plans, your documents, your policies and procedures. Then we're going to identify activation triggers and monitoring plans so that you know who's telling who to do what and when they're telling people to do it. We've all seen those beautiful binders on shelves that are beautifully labeled and sorted and have wonderful pictures and graphs in them that are covered with dust because no one has ever picked them up. And we know those binders tell you what to do. The problem is they don't tell you how to do it. So we're going to walk with you to create a comprehensive plan to tell you how to do it and how to develop and conduct training and testing once you have your plan in place, and then also to design supply solutions if needed to support any type of internal product support needs that you may have. So what we're seeing here on the screen is a sample of a communicable illness plan. That's actually, there's a couple of pages I've left out of this, but it walks through the plan purpose, the objective, the scope, roles and responsibilities, and moves forward through all of the forms and appendices that you might need in order to implement this in a very real way. In order to help you move that effort forward, we created a paper on communicable illness, and we covered everything or every question that we could think of and that people had asked us that might come up with some of our expert council members with expertise in this area, and our own internal attorneys, insurance representatives, and other healthcare professionals. And we came up with a paper. It's about 40 pages, maybe 36 pages, and it is a free resource that you can download from the website, and it covers all of the questions that you may ask. And you can find that at firestorm.com/illness, ILLNESS. And this paper is going to walk through attendance and leave policies. What union contracts are in place, and what information is there? What happens if there's a reduction in force that's required or needed? When are you allowed to, or can you send workers home? How about, can you require teachers to stay? And can you require someone to stay who has refused? If you have a staff member or teacher or a facilities manager on your campus and they say, I'm not coming in because I can't afford to get sick, my family can't afford for me to get sick, does that person have a right to do that? What are the pay policies during that period? Do you have those set? What about any work restrictions that might be as a result of an illness? Is there any way you can do any sort of telecommunication, telework? Are you set up now to do that? Do you have a VPN or some other means of making sure that people can access the email and conduct classes or other business? Do you have benefit plans in place? Of course you do, but do you understand how they affect in this area? How about employee assistance programs? Do you have something in place? Do you know to contact people? Can they assist in this issue? What are your school visitor policies during a period like this? And do you have those policies written, updated, and reviewed with employees? Firestorm follows a Predict.Plan.Perform methodology. We predict critical vulnerabilities, identify key personnel, ascertain any critical decisions that you need to make. We're your critical decision support team. We analyze the gaps, identify your infrastructure and supply chain needs now, and then define what your communication requirements might be. The planning phase is where you develop the strategy. Then you construct your plan, and then bring in the appropriate personnel to assure buy-in and commitment. And last, the perform phase is where you establish protocols for implementation. You bring the community in, your parents in, city officials, communications. You conduct test exercises, which schools are great at. You do audit reviews, updates, and then check for compliance. I want to thank everyone on this session today, and especially our guests from the Virginia Association of Independent Schools. Kim, do you have any closing thoughts today?
Just one, Karen. I can't allow the webinar to pass without my annual talk about the influenza vaccine. The influenza vaccine remains the best prevention against flu. The CDC predicts what kinds of viruses are going to be prevalent in the United States this year, and they produce a vaccine against those viruses. If they get it right, we have pretty good coverage. If they miss it, we have varying degrees of coverage. But the influenza vaccine remains the best way to prevent flu. I personally take it every year and have done so for the last 25 years. So I
have met Ken, and he is an exceptional. I said I have met Ken, and he is an exceptionally healthy specimen.
I didn't want to allow the webinar to go without giving my little promotion for the flu vaccine. So that's it. Thank you.
Thank you so much, Ken. Thank you again to the Virginia Association of Independent Schools. Again, you can visit us at firestorm.com. You can email us at webinars@firestorm.com. You can talk to the lovely and wonderfully voiced Bill Baker if you call our 1-800 number. And if you'd like a document like this for your individual organization or a presentation, just let us know. We'll be happy to work with you. That'll close our webinar today. I appreciate your patience during a couple of little technical difficulties. Have a wonderful day, and I look forward to seeing everyone on December 7th for our virtual event, Lone Wolf or Terrorism, doesn't matter. Thanks so much, everyone. Goodbye, and have a great day.
Thanks all. Goodbye.